for yet another of our hopefully now famous Webinar Wednesdays, where we come on for a few minutes and share what we've been up to. So today we're going to be talking a bit about a new dashboard that we have put together and doing a little test drive and showing off what that's about. So this is going to be a new dashboard that kind of looks at the number of coronavirus cases in Baltimore by zip code, and we also take a look at calls to 211, 311, and 911 to see what are sorts of requests that are being made to United Way, to the city, and to the police. So we are going to be recording this session. If you have some colleagues or some friends that aren't able to hop on to join us, we always post these videos the same day on our YouTube channel, BNIA JFI. And we are going to have some folks manning the chat. So if you have any questions, feel free to pop those in there and we can either answer them in the chat or get to them at the end. So very briefly, a little bit about the Baltimore Neighborhood Indicators Alliance. So we're a nonprofit, started about 20 years ago. We're based at the University of Baltimore, and we're a one-stop shop of data and information about Baltimore's neighborhoods. We look at data longitudinally, so we look at data going back, in many cases, back to 2000, all the way, in some cases of our data sets, that are current through 2020. We look at multiple topic areas. So we are interested in seeing what are the demographics of neighborhoods, but then also what data sets can describe the housing conditions in a community, crime and safety, education, the arts, the environment, workforce and economic development, and so forth. So we have a lot of data. We've been doing this for many years, and one of the real reasons why we were created was to provide data. So many years ago, before open data was a phrase that people were at least a little familiar with, it was difficult to get data and information about your community. You would have to call up lots of different agencies, organizations, hope people return your phone calls. So the Urban Institute worked to create the National Neighborhood Indicators Partnership. We are the Baltimore organization with a Baltimore partner, and we're one of about 3 dozen cities that also focuses around this idea of data democratization. So data that is about people should be made available to the people. So the primary thing that BNIA is actually known for is a report called Vital Signs. So we've been doing vital signs for many, many years now, going all the way back to 2000. And we just released our 18th edition of Vital Signs this spring. We're still in the process of getting some of the data finalized. And our Vital Signs 18 edition contains data for Baltimore and its neighborhoods through 2018. We look at demographics, as I mentioned, housing, health, crime, so on and so forth. You can access our data, our maps, narratives, a ton of resources for our 55 communities in Baltimore, and again for the city, on our website, bniajfi.org/vital signs. As we've been releasing the 18th edition of Vital Signs remotely since we transitioned to work at home in March, we've been hosting these webinars. So if you're interested in checking out some of our past videos where we use these Wednesday webinars to share this data and information, again, check out our YouTube channel and our website. So in addition to working on the Vital Signs report and working with other folks in Baltimore, we've had a lot of questions about the coronavirus and really kind of thinking about, you know, who is being impacted by the coronavirus? What does the impact look like on neighborhoods? And we're in a pretty unique position where we're able to access a lot of different data sets that are being published by the city and the state, as well as a wealth of resources that we already have in-house because we've been doing this for 2 decades. So you can really think of it in terms of these basic questions that people came to us with. So, and not just us, but asking the research community at large. So what populations of people are vulnerable to the coronavirus. So thinking about age, thinking about race, thinking about ethnicity, and also thinking about place, and especially in regards to Baltimore. So where are the sensitive, where are the vulnerable populations in the city? Also, March 30th, the Governor Hogan, instituted a stay-at-home order for the state of Maryland. So what are the implications of that stay-at-home order? What does that mean for residents? What does that mean for neighborhoods? And can we actually see something in terms of the data? And then also just like knowing that there are vulnerable populations, knowing that neighborhoods are being impacted. A question that we've been asking is, well, what do people need help with? So is it access to healthcare? Is it assistance with educational resources? So those are some of the things that we've been thinking about, trying to come up with tools to help answer some of these questions. And that has led to really a creation of a suite of different visualizations and other dashboards related to coronavirus. So one of the first things that we had produced was an infographic. It feels like a million years ago now, you know, very, very early April, late March, thinking about what is the impact of lives saved by staying at home if you were able to do so. So we partnered with one of the National Neighborhood Indicator Partnership partners in San Antonio to get a model from epidemiologists to kind of calculate, like, what is that impact? How many people can be saved by staying at home? So that was kind of our first toe dip into thinking about ways that we can answer questions about what's this impact of COVID-19. So we were also getting a lot of questions, as I mentioned, like, what are the vulnerable populations? Where are they located? And so we created an online interactive map. And we did host a webinar a few weeks ago where we walked through this map. Again, keep shouting out to our YouTube, but we've been putting a lot of data and resources on the web, and I just want to make sure lots of eyes are seeing those. So what we've been able to do is pull in a data set that the Maryland Department of Health has published on a number of coronavirus cases by zip code, and plugging that in. So in this case of the map, they're visualized as different size proportional dots overlaid with our vital signs community indicators. So again, looking at race, looking at age. So where are older adults living in the city? Where are school-age children? And then thinking about some of the housing impacts. So where are folks paying a large percentage of their take-home pay on housing costs? Thinking about also things like digital equity and digital access, of who has access to the internet, so who can actually work from home. What children are able to access the internet on a computer, not just a smart device, to connect with teachers, to work on homework, and to continue their schooling. So this was a very important map that is continually being updated. So it's plugged into the Maryland Department of Health and their data. So we're pulling in their API. So every morning at 10 a.m., we've got a new cut of this coronavirus case information. So again, we like to listen to what people are asking for and listen to various things that are also coming out in the media. So there were a few questions that were posed to us, and we saw some articles coming out from the Baltimore Sun about impacts of the stay-at-home order and coronavirus on crime specifically. So a few weeks ago, we put together a dashboard that looks at the first quarter, so this is January 1st to May 31st of 2020, comparing that time period to previous years, so 2018, 2019, to see what is the overall number of crimes, violent crimes and property crimes, where are they occurring, and we're going to be updating this as well for the second quarter of 2020 to see how is the second quarter, so again, April 1st through the end of June, how does that compare to previous years? What are we seeing in the data? But so let's get to why everyone's here today. So our latest visualization is a dashboard that looks at calls to 3 different systems. So again, we started thinking, okay, well, we've got crime incidents, but what are the 911 calls? What are the 311 calls? and also what are the 211 calls. So we've built a platform that allows for folks to look at data at the zip code level. And again, this is kind of meaningful. Normally we love the community statistical area, but we're only able to get coronavirus case counts at the zip code level. So what are the top 911 calls? What are the top 311 calls and the 211 calls for service? So if you're not familiar, 211 is a service that's offered through United Way. So if you need assistance with housing, with health care, getting connected to social services, it's a hotline that is available and exists throughout the country for you to call and get connected to referrals and to resources that you may need. 311, that is a non-emergency, but also kind of like citizen customer service request. So if you have an issue in your community, be it rats or trash or down tree limbs, that's a line where you can call in and have a city service, so DPW, the health department, housing, to come out and address an issue that's going on that you're reporting. And then lastly, 911 calls to the police. So where are these calls coming in and what are their different types? And so all of these things are on our coronavirus OpenData Portal. So this is something that we host through what's called ArcGIS Online. It's a platform created by Esri. So they do a lot of the desktop mapping software, and we've been trying to take advantage of as many of the resources that they have available. So I'm going to close down the PowerPoint and let's switch over to the web so that I can do a quick walkthrough of these tools. So let me close that. So here is our Baltimore City citizen-driven service request by zip code. Ooh, that's a mouthful, dashboard. So this dashboard, when you first come to it, it provides some basic stats for the city of Baltimore. So you can view data for the city at large, or you can drill down to a specific zip code, but the default view is for the city. So on this map, we have all of the zip codes and their boundaries. So when you select a zip code, it'll kind of show you what those boundaries are. We've got at the bottom below the map, the number of COVID-19 cases. And this is coming in again from the Maryland Department of Health. This number might actually look a little funky compared to what you might see on, say, the city or the state's coronavirus data portals. That's because we're pulling in zip codes that fall within the city limits, not just necessarily Baltimore City. But once we start drilling down into those individual zip codes, that's the number that you're going to want to take a look at. And then lastly, and most importantly, on the right-hand side, we've got these three different charts. So at the bottom, we have a little tab where you can toggle through. The default is showing 911 calls. You can also take a look at 311. And these are all stacked bar charts that show you the number of calls across time. So we started looking at this April 1st. So that's kind of like a good starting point. The stay-at-home order went into effect at the end of March. So April 1st going forward. And then for the 211, we're just looking at a cumulative by zip code, like what sorts of calls are being placed to 211. So what I'm going to do is start playing around with this a little bit and show you how this tool updates itself. So on the left-hand side, we've got a select your zip code. So again, the default is Baltimore City, but if you wanted to look at one particular zip code, you can select that. So I am going to select 21202. So this is downtown and kind of like the east side of downtown. So what happens is the map updates. So it's just looking at 21202 data. It updates this little box down here. So this is the total number since testing started of coronavirus cases in that zip code. And then we have an updated 911, 311, and 211 charts. So you can hover over these bars and these different colors to see what the value is. So for the 21202 zip code, disorderly conduct is the predominant 911 call. So there's a lot of reasons why people might call 911. What we ended up doing, because you don't see like the 200 different types of calls that you could have, we did an analysis and we were able to identify kind of like the top 10 calls for the month of April. And we used that citywide to then influence what are the top 911 calls for each of these zip codes going forward. So disorderly conduct was unfortunately the number one 911 call, but then you also have things like auto accidents, that's down here in blue. We've got burglaries, we've got common assaults, destruction of property, so on and so forth. It's the same thing for the 311. Again, we looked for the month of April, what were the top calls citywide to 311. So these were things around dirty alleys, dumping, some parking complaints. And then we also included some things like COVID-19 donations for things like food and resources, and also rat rub out, because we've gotten a lot of requests about whether or not the calls to report rats has increased or decreased. So the interesting thing about all of this is that this is just a cut of data for that particular zip code. And not every zip code in Baltimore is the same. If you're from Baltimore, you know this. So the top calls in 21202 might be very different than, say, the zip code where I live right now, 21239, which might be different than, say, Park Heights, 21215. So this tool allows you to select these different zip codes, and as you do this, you can see these charts updating themselves. So let's just keep grabbing some of these. So 21211. So this is a community that has only had 79 cases of known cases of COVID. And again, you can see the distribution. So in this case, disorderly conduct has been the predominant, but you've also seen some variations in auto accidents. You've seen variations in larcenies across time. And in terms of the 211 data, the majority of calls in the 21211 zip code are actually for COVID-19. So these are people calling to get help, to learn where you can get tested, to learn about symptoms, to learn how to connect to a doctor. Then you also have things like housing and shelter. And so for all of these, again, if you hover over, you can see the values. And again, these change pretty dramatically for the different zip codes in the city of Baltimore. You can also, this is kind of a cool thing that I didn't even realize for the longest time, and yes, I developed this visualization, is that you can actually turn on and off some of these items. So whether you're looking at this kind of pie chart, or if you're looking at bar charts and you just want to drill down into a couple of categories, you can do that. So you just click in the legend on these different items, either the name or the color, and it will start hiding these things, and automatically it will update the visualization. And so lastly, we've got a tab here that just describes the data. So what is the data source? Where did we get it from? What are we looking at? What's the time period? The great thing about a lot of these data sets that we've been looking at lately is that they are open data. So the 311 and the 911 data sets, these are available on the city's OpenData Portal, so you can access these, and we've got the direct links to download or to access the APIs on Open Baltimore. And then we've also, this is our first time really looking at some of this 211 data. The 211 data can also be accessed on a dashboard, and it is already kind of pre-calculated where you can look at some of these call types and counts by zip code, and they also have some pretty cool maps and other visualizations. So where can you find this? Because the URL is kind of crazy. I don't want anyone to frantically be trying to write this down. So how do you get here? So from our main page, so this is beniajfi.org, we have a link to our Open Data Portal. So we've got a lot of cool goodies on here. So the website, yes, of course, is cool. We've got vital signs, we've got maps, we've got a lot of cool stuff, but I'm personally really excited about all these amazing things on our Open Data Portal. So if you click on that, it will take you to a landing page where you can scroll down and then access not only our vital signs open data portal page, so this is where you can pull down all those vital signs data sets that I was talking about earlier. We also have downloadable data. We partnered with OSI Baltimore on their Blueprint for Baltimore survey. We've got GeoLoom, which is an arts and culture mapping tool. But right here, the second one, this is the exploring the impacts of COVID-19 on Baltimore's communities. So this is where we've got all of our visualizations. So we've got our map here where you can access the COVID cases by zip code, along with our community indicators. So like right now we've got older adults kind of going on in the background. I'm going to scroll down. And so here we've got our citizen-driven service requests by zip codes. This is our brand new dashboard. And then also links to our other COVID-19 visualizations. So I'm going to stop here because I need to take a big gulp of water, and I want to open it up to questions that we might have. So thank you for joining us, and really excited to continue these visual